It's the most common dominantly inherited disorder in man. And it's the most common condition you've never heard of. About 1 in 250 Americans have it, but only about 10% of the individuals that have FH know they have FH. All right? Why it's important to differentiate from just high cholesterol is it's genetically inherited high cholesterol. So these individuals with FH have extremely high cholesterol levels from birth. So by the time they're 30 years old, if they have the more common form of FH, their arteries are as clogged as if they were 60. If you have the rarer form of the condition, where you inherit it from both parents, those arteries start clogging at about 13. All right, so it's a very serious condition. It's dominantly inherited, so when you find an individual with FH, there's a 50-50 chance with all other family members, first-degree blood relatives, will also have FH as well. Any individual could have FH, and the two phenotypic things that are needed for a diagnosis is a untreated LDL above 190 and a family history of early heart disease. Those two things are enough for a clinical diagnosis. Machine learning is in your everyday life. If you've ever had a successful Netflix recommendation, or if you've ever had a successful Amazon recommendation, that's machine learning at work. Basically what it does is find patterns in data. And then once it finds that pattern, it trains on that pattern, and then it looks to apply that to a much larger data set. So in healthcare, if you show a machine, the machine learning application, what an individual with FH looks like, it learns what that pattern looks like. Which doctors are they seeing? What medications are they on? How are their labs responding to those medications? And it builds that pattern, if you will. And once it has that pattern, it starts to look for that pattern in a much larger data set of individuals that have not been diagnosed. So just as it works for Netflix and Amazon, it can work in healthcare. There are all limitations. The algorithm is not infallible. That's why it does not diagnose. That's why only a clinician can diagnose. When you build these models, you strike the balance between how precise the model is versus how many of the patients you're finding. We tend to err on the side of trying to make sure the model is more precise. That means we may miss a few undiagnosed patients. But we think that's important to do so that we don't overwhelm clinicians with maybes. We want to concentrate on the probables. The key takeaway from this conversation, I hope, is that technology is available to help us find patterns in healthcare data, to assist clinicians. These type of machine learning algorithms do not diagnose, but they can identify the vital few and separate them from the critical many that may have a given condition or disorder so that a clinician can go ahead and further screen and diagnose.